All right. Hi, everyone, and welcome back. Once again, I've got Dr. Alireza Sadr with me, my friend and a fellow colleague, and I believe scientific advisor for the ABD. Is that correct?
Yes, that's right.
So he's one of our esteemed scientific advisors. And if you're watching this quick teaser video, this is going to be the second of two. It's a two-part series, and I hope you enjoyed the first one. It was fantastic. And in this one, this is all about a specific technology that Dr. Sauter kind of developed and had a lot of work in. And the subject matter is going to be specifically about, I wrote it down right here, restoration of structurally compromised teeth. Pretty cool. But rather than me talk about it, I'm going to ask you, sir, what are we going to be learning on this upcoming webinar? Lay it on us.
My colleagues at ABD are talking about a series of, again, technologies and techniques to improve the longevity of a restoration of a structurally compromised tooth. Structurally compromised tooth, a tooth that has lost a lot of tissue, cracked tooth, teeth that had deep decay, and things like that. What I'm going to show is based on the research that we have from optical coherence tomography. So I will justify and explain why we are doing things the way we are doing, not based on numbers, not based on graphs and very complicated statistics, but based on visual, because that's what OCT is.
So that I have to ask, so what is OCT and how do you use it?
So optical coherence tomography is a 3D in-depth imaging technique that has been used in medical science for a couple of decades now. What I did and what my research team did was to bring this into dentistry for real-time characterization of composite behavior as their place for restoration. So you may think it's a straightforward subject, but the amount of research and knowledge that we developed out of this very specific subject is incredible. So basically, it's a 3D imaging technique that allows us to see.
Didn't you originally start using this tool and this technology for one purpose, but then you quickly realized that you could use it for something else that is even better or more helpful?
Yeah, it's a long story. OCT wasn't new to dentistry when I got familiar with it. So there are
Yeah.
pioneers here in the United States who've done that for several years. I don't want to name anyone, but we got interested in a faster system that was actually giving us the 3D images in real time.
Real time.
Yeah, and then yes, it was for decay diagnosis, and I sort of discovered that it's a great way of looking at restorations, restorative materials, shrinkage, bonding, and all other stuff. So yes,
So to kind of see where it's at and give us an example, I guess, or what you're going to show us.
So one example is a very simple example. So we have several bonding agents, several adhesives that we put in the cavity, and then we fill that cavity. And as we are light curing or polymerizing the composite, we're going to look at the interface and the interaction between the restorative material or the restorative system and dentin, and see which of these bondings stay bonded at the end and which of these bondings don't stay bonded at the end of polymerization. So this is one example. Some may have seen it. It's really exciting I have never had a presentation across the world with this stuff that never had a presentation across the world with this stuff that did not impress at least a large number of dentists. I've never had a presentation with people not coming afterwards and tell me, this was the first time I saw it. It's incredible. It is wonderful.
So this is real-time, hands-on subject or a tool or strategy that you're going to be teaching the practitioner?
Yeah, so what I'm going to be teaching the practitioner is how to do restoration of structurally compromised tooth. Not every practitioner in the world, in fact, nobody in the world except us and my colleagues have access to optical coherence tomography. So they don't need optical coherence tomography to do the restoration. But based on what they learn from optical coherence tomography, they will be able to do the restoration steps right.
Interesting. Okay, so they don't necessarily need to have that tool or that the device, is it, or is it a technology?
Device, it's a device.
So they don't even necessarily need to have it in their office, but as long as they understand why they're doing things a certain way, protocol, they now have proof of why they're doing it that way.
Yeah, absolutely. So one day, not very far, maybe by the time our Mars rover will send us the information, we will have OCT available to the dentist, the dental community. Actually, the FDA in Japan just approved it. So it's an
Oh, cool.
approved device in Japan. And we
Okay.
will have hopefully approval someday in the United States of a commercial system so that our colleagues will be able to actually have this in their office and look at the quality of restorations that they've done in 3D right away. There is no X-ray, no ionizing radiation.
Wow.
Yeah, so
Wow.
it's a possibility in the future. But right now, I can tell them exactly what we do with this in research and what the results are, which are eye openers, as I said, for a lot of people.
Oh, you're leaving me hanging. So when is this coming? And tell me about these eye openers. I want to hear more.
So a lot of us have been using fiber reinforced composite.
Yeah.
Show how exactly fiber works in cavity. That's what I'm going to show with OCT. I'm going to show a lot of different systems of composite restorations, what is coming, what is in the market, and a little bit touching on the bulk fill issue and the idea about bulk filling, what works and what doesn't work. Again, what bonding works, what bonding doesn't work, and why we do things the way we do at AVD.
So visually, this presentation is going to be pretty cool to look at things. There's going to be quite a few visual images to look at, right?
Yeah, that's an important point because as a dental student and as a beginner dentist, as I started to go to these presentations, people were showing a lot of graphs and numbers and bond strength and all that.
Yeah.
I would say that they're meaningless, but seeing is believing. You're gonna see why I say A or B or how we do things, and it's a lot of visual. There's more visual than numbers.
I mean, that's fun, right? Visual is definitely fun. So who should come to this, in your opinion? Who do you think would be the perfect person to come to this webinar?
Anyone with an interest in adhesive dentistry and biomimetic dentistry, whether this interest is rooted in their research interest or more importantly, their practice philosophy, should come here and be with us and learn about it. If you're new to biomimetic dentistry, there will be really cool stuff, eye-opening stuff that you will see and you'll learn something that you probably have never seen anywhere else. If you've been a biomimetic dentist for a while, I do have new stuff. So yes, we've had that narrative for several years. I'm just adding with our new research at the end. So there is new stuff going to be there. So it's for everyone.
So what's the cliffhanger? What's the new stuff without telling us? Can you give us a hint?
We have a little bit about cracks. We have a little bit about the new composites that are out there and a little bit of research on them. And that goes back to the title of presentation, which is Restoration of Structurally Compromised Tooth. It's a developing topic. It's a developing technique. So in real time, I'll tell you what's new.
Awesome. Doctor, thank you very much. So hopefully everyone enjoyed this quick little teaser video. And right now, while it's fresh on your mind after watching this, please go to our website, Academy of Biomimetic Dentistry, and find the webinar page and go ahead and register. And we want to see you on the webinar. Dr. Sadr, thank you again.
Thank you very much. Look forward to seeing you.